It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
And hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network, featuring some of the best doctors in the entire Houston area, Candace, that help change people's lives.
Yes, they do, Jim. And we're going to start off getting to know our first best doctor. It's gynecologist Dr. Farhina Imtiaz.
Well, I was having extremely heavy periods that were just getting worse and worse, very painful, just a lot of discomfort. So the only real option for me was hysterectomy or live with it until I go through menopause. And I'm young enough that I thought it was disrupting my life.
So I tell you, when I started in medicine a while ago, most hysterectomies were done abdominally. There was a large incision made from hip bone to hip bone. Patient would be in the hospital for a week, and her recovery, a very painful recovery, 6 to 8 weeks later. But what's fantastic is over the last few years, women have choices. We have technology available that allows us to do big surgeries through little incisions. And it depends on the patient, depends on what her symptoms are, depends on what her needs are, and what her wishes are.
Oh, it was so easy. I woke up in the recovery in a chair, and within an hour and a half to 2 hours, I was up walking to the bathroom. No pain at all. Went home in the car. And really, I was up and walking around within just that day. I was up walking around, on my own.
It's a very new procedure, and there are very few surgeons in the country that perform it. Aesthetically, it's very pleasing to the patient because the surgeon uses one incision only. It's a very small incision, approximately 2 centimeters in length, and we hide it in the folds around the belly button.
Well, it was a whole lot easier than I expected it to be. I'd had 2 C-sections in the past, and those were extremely painful procedures afterwards. And this hysterectomy, I went in the morning, did the preparation and had the surgery, and I was home by 3 o'clock in the afternoon, walking around fine. I was fine. I
think most young women, especially those who exercise and take care of their bodies, want the option to be able to hide their scars. You don't have to show them. So with the less procedure, I'm able to give them that option. I'm able to allow her to treat her problem while cosmetically achieving superior results.
For numerous years I've had varicose veins. I'm a registered nurse, and so I have been on my feet for 20 years, and also heredity has played into that. And so just a lot of varicosities and some pain, aching if I've been standing on my feet for a long period of time, and then just unsightliness.
Varicose veins are a symptom. They're a sign of an underlying disease or abnormality in the venous circulation. In your legs, there is no heart to pump the used blood back up, and so the pumps are your muscles. And when the veins become too large and one-way check valves have failed, now all the pumping doesn't work and the blood pools in the legs. It creates high pressure, which results in bulging, enlarged veins that we call varicose veins.
My dermatologist recommended Dr. Morgan, and he was very forthcoming with information. It wasn't a lot of extraneous things that I didn't understand. It was very to the point. Exactly what he could do for me, and what the benefits, what the side effects, and it gave me an opportunity to just weigh the pros and cons of whether I wanted to go forward.
The treatment is to close all the veins that are running backwards. Any vein that is not pumping up out of the leg is only hurting, it doesn't help. And so by removing or closing those veins, you restore the circulation out of the legs back to normal.
The procedure itself probably took 30 to 45 minutes. I was able to get up off the procedure table right afterwards and walk. I did have improvement in cosmetically, which is a wonderful side benefit, but I also have decreased swelling, decreased aching. Really, it's very minimal.
She got a great result. Her swelling has gone away completely, her pain has gone away completely, and her varicose veins have gone away completely as well.
All of the physicians featured here on the Best Docs Network are all about changing people's lives. Like our next Best Doctor, it's oral surgeon, Dr. Paul Metz.
Yeah, I lost a couple, and the rest of them started getting loose, and it was something that took about 5 or 6 years to happen. It just suddenly came on, though.
Yeah, George, his teeth were in an end stage in that they were decayed, and he also had periodontal disease, bone loss around his teeth. His teeth were chronically infected. They had become loose. Also, there was a cosmetic problem with his teeth, and George is a very outgoing person and likes to smile and has a great smile, and so his smile just didn't suit his character, not to mention the health of his teeth. It was really driving him down.
I was kind of getting to the point where things that required real chewing, particularly in the back of my mouth, was getting more and more difficult.
With George, what we did was removed his teeth. Now in him, we focused on his lower jaw. And from a financial standpoint, many individuals decide to maybe focus in one jaw versus the other. Now granted, with him, we could have done both of them simultaneously, but for whatever reason, and oftentimes it's schedules, their busy work schedule, also finances, that they'll sometimes stagger the case to suit them better. And with George, we focused in his lower jaw and we removed all of his teeth, upper and lower, but we put the implants immediately in his lower jaw.
I'm feeling fine now. I'm back to the point of eating anything. There's no problem. We're continuing on. I'm not quite through with all the procedure, but just about.
And that is a misconception that we're seeing right now with the advertising, where it talks about get this all done and completed in one day. Reality is the final is usually done later down the road once the body has fused to the implants, and the textbook answer for that is at least 3 months, but it can be as long as anywhere from 3 to 6 months. But the standard of care is to keep the patient in a provisional, a prototype, if you will, for a period of at least 3 months.
According to my experience, no question about it. Don't be waiting on it. The earlier you start some treatment, clearly the better.
Wouldn't it be great if we had a blood test that could tell you if you had cancer or you don't have cancer? Well, we don't quite have that yet, at least for most cancers, and in the future we probably will. I would say within 5 years there will be tests that we can do on your blood that will tell us if you have a tendency towards certain cancers or if you even have cancer cells in your body. There's a lot of genetic testing and a lot of research going on, so there's great things are going to happen. Now, as it is now, there are certain tests, for example, for ovarian cancer. There's a test called CA125. You don't need that test unless you have a strong family history of things like cancer of the uterus or ovary cancer in your family. However, it is a good test and can tell us if that cancer is brewing. There are certain tests that help us with pancreas cancer. But in general, the blood test that you have when you do your physical give the doctor a clue as if you are at risk for cancer. For example, you might be anemic, or your platelets, which is part of your red blood cell count, may be high. There's also other things like liver tests that may be elevated and that indicate your cancer risk is high. So get your blood test done, check it out, and hopefully in the next 5 or 10 years, there'll even be better blood tests.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education and the Medical Minute tab.
Coronary disease is a type of vascular disease where plaque coats the inside of the vessel to the point where there's a growth, and that's called stenosis. The number one problem with regard to formation of plaque is cholesterol. So we have different types of cholesterol, LDL cholesterol. We have HDL, which is the good cholesterol, LDL being the bad. Triglycerides are another bad cholesterol. So it's very important to do advanced testing of the lipids.
Back in 2000, I went working, had some pains in the chest, went to my general practitioner. He examined me and said, "You need to go see the cardiologist today." Made an appointment for me with Dr. Varicose, and when she examined me, she said, "Just stay right there. You're going to the hospital."
The case of Thomas Cole is quite interesting. He came at the beginning of my practice years. I've been practicing for 18 years now. And Thomas Cole came as a new patient and just complained of intermittent chest pain. We proceeded to take care of him, and he proceeded to die on the table and had no heartbeat. So we, of course, started resuscitative measures immediately and quickly transported him to the cardiac catheterization laboratory, found a severe blockage in the right coronary artery, and that's why he had become hypotensive. His blood pressure had dropped, his heart rate had slowed down to nothing, and he had stopped. So in the office, I pounded his chest and started CPR, and then we took him to the cath lab.
I was very lucky. I mean, if you're going to have that kind of thing happen, being in a cardiology office is one of the better places to be. The thing that's most amazing, I think, about Dr. Varicose is her concern for her patients and her constant drive or constant searching for things to help them, not only when they've had the heart attack, but help in prevention of the heart attack. Her personality of her patient care is phenomenal.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
For additional health information, be sure to check out our Healthy Living blog for the best tips, latest medical procedures, and up-to-date news for modern medicine at our website at bestdocsnetwork.com.
My migraine started March of 2009 from a faulty spinal tap, and right from there, my migraine never went away. I've gotten many treatments, a lot of medications, and I've seen countless doctors, and I just didn't get any relief. My mom and I went to Dr. Reed, and he felt like I was the perfect applicant for this stimulator.
I remember when Andrew came in for the permanent unit, we had to decide which side to put the battery on. It goes in the upper, outer, kind of rear gluteal region. Andrew wanted it on, I believe, the left side. Because he's a baseball player, he slides on his right side, so he wanted it on his left side. Which brings up an excellent point about the stimulators. There's no restrictions. Here's this very active young man, baseball player, sliding left and right, and no problem. He has done absolutely fine with the stimulators.
So I got my permanent stimulators implanted, and they put a little battery right at the hip, and it runs up your back. And I have 2 leads on my back, 2 leads on my temples, and 2 leads right here. And I'm able to control the frequency and the intensity of the stimulation with a remote. It's amazing what Dr. Reed has done, and I'm so appreciative of him.
He came back recently having lost a lot of weight. He lost so much weight, the little battery had gotten more superficial, and I needed to replace it a bit deeper in. but he was doing great with it. He's looking forward to going to college up at Texas Tech in a year. Like a lot of patients, he's done very, very well. I think it's safe to say that it's changed his life, certainly changed it for the better.
I don't care about having these batteries and these wires inside of me. I'm just so happy that my migraines have gone away. It's amazing what Dr. Reed has done.
For more information on any of the doctors you've seen on today's show, just visit our website. It's bestdocsnetwork.com.
There you go. Right now it's time to go to our next best doctor. It's Dr. Stephen Rose.
I saw the potential in 3D at really taking digital to where we needed it to be, and it really has become what I would call a revolution. And I was very strong in my recommendations to the company that we really focus on looking at this as a screening tool. That's where it was going to make its impact.
2 years ago, I went for my annual mammogram and was in there, and they told me that they were doing a study for the 3D, and they asked me if I'd like to participate, and I said sure. I was already back there and undressed, and it was not a big deal.
She was the second patient in the multi-center trial that we did in 2010, and you had to come and get your standard 2D digital mammogram, which got read separately, interpreted by a different radiologist, and then the 3D exam would be performed separately.
First, I got the letter that said that no problem, didn't see anything, come back next year. Then I got the phone call and they said, well, no, we saw something in the 3D. And it turned out that one of the tumors was actually an aggressive, HER2 had a HER2 marker in it, which is can be one of the more aggressive cancers.
As we're able to page the breast a millimeter at a time, we're able to look at areas that we would struggle with before on the 2D mammogram and say, is that something or not something? If you find malignancies less than 10 millimeters in size, the prognosis for the patient is essentially the same as the general population. So most of those people, the vast majority of those people, 98%, are cured.
Obviously somebody up there was looking out for me. I mean, I think it's the greatest thing. I mean, I think it saved my life.
So this woman had received a normal letter for her regular digital mammogram, but on 3D, we were able to find 2 very tiny cancers. That's the value of finding it at this stage, and that's what makes this test the most exciting thing I've seen in my professional career.
Gosh, I was young, maybe about 6 years old, and was tagging along with my older brother playing golf, and I just so happened to get too close to him when he was teeing off and got hit with a backswing right in the nose. And from then on, that's when the problem started.
Joey came and see me because he can't breathe through his nose. So he has to breathe through his mouth. He doesn't sleep well at night. He snores a lot, and that makes him tired all the time.
You know, you would sleep through the night but wake up and not feel rested. You know, even though you made it through a whole night and got a whole night of sleep, you just wake up and feel like, gosh, I really don't even feel like I slept at all.
When we examined Joey, we noticed that the wall in the middle of his nose, what we call the septum, that separate the left and the right side, was crooked, in his case, was crooked on the right side, causing him problem to breathe through his nose. And we agreed upon a treatment plan that consists of first a surgery to correct his septum, to straighten up his septum, so to improve the nasal airway.
Very simple outpatient. Everything was explained to you. Go in the morning. I actually took a little nap right before surgery because it was early in the morning. Woke up and that was it. So it was real simple, real easy.
Joey's quality of life has improved tremendously. He breathes better, he sleeps better, and he enjoys life more.
Well, you just don't realize it because I've had it for so many years. You just get used to, you're thinking the way you're breathing is normal, and it's not. And then once it's changed the way it is, I'm able to do things without getting winded, because I'm not having to open my mouth to breathe now. I'm able to breathe clear through my nose.
The number one reason that patients come and see me is because they can't breathe through their nose. In most of the case, there's a solution for that. As a center of excellence in nose and sinus disease, I'm always in the forefront of medical research to improve my patient outcome. Medicine has advanced so much that there's always a solution to breathe well and live well. Patients don't have to suffer anymore.
For more information on any of the outstanding doctors you see on today's show, head to the website, check out more information as well as videos at bestdocsnetwork.com. Right now it's time to head to our next best doctor. For those suffering from allergies, Dr. Lynn Dickens can help.
I think there's a lot of confusion now about exactly what an allergist is, because a lot of people do allergy testing that are not board certified in allergy and immunology. So what we see actually in this practice is not always allergy, but people come to us because they think that it might be allergy. Well, Lil Garrett Mueller, that has been a patient of mine for quite a few years, has multiple food allergies, and this has really been his biggest problem in life, is learning how to eat properly and not be different from the other kids. His mother brought him to us early on, and we were able to diagnose some of his food allergies, and he's outgrown a few, but he still has some that are very dangerous for him.
Because allergies run in our family, and things like asthma and things as well, we came and had him tested at the age of 1. And at that point, we found out that he was allergic to all dairy products and also peanuts. So it changed how I had to shop and how we did things in our home. I would label foods that said, "No, Garrett," and label things that said, "Okay, Garrett." We had a Garrett shelf.
Actually, Garrett brought this to one of his office visits, and I was so amazed by it. This is Garrett's story of his life with food allergies and how it affected him, and he fully illustrated this book himself. And it's pretty amazing from the time he was first diagnosed and how it affected his life. This is a very verbal young man who knows what he needs to avoid and what he needs to do. So we're hoping that maybe one day he'll be able to be a little ambassador in the world for his food allergies.
She talks with Garrett, she asks him questions as well as asking me, and she really listens, and that helps us to be able to manage his allergies and his asthma. If you want a doctor who will take time with you, who will get to know you and work with you on your own preferences with the medicines and things like that, that Dr. Dickens is the person to see.
What is advanced lipid testing? Most of my patients say, well, I had my cholesterol checked with my doctor. I say, well, advanced lipid testing is different. It evaluates different parts of the cholesterol, different areas that we can effectively make change. So it's important to do an advanced lipid analysis. There are multiple companies who provide that service, but ask your doctor to look at your lipids in a more advanced way, because there are things on the lipid analysis that can tell us if you have early diabetes, insulin resistance, if you have a high tendency towards clotting, if you're genetically prone towards having a heart attack or not. These are important questions that you need to know. When we're sitting out there in the communities and we have physicians that may or may not know about these things, I think it's important that there are informational shows like this out there that can teach you, the public, to check on your own health. So ask your doctor for advanced lipid therapy. It's an amazing way to take hold of your own health.
Charlie's weight was 380 pounds with a body mass index of 58. So, I mean, he's clearly in the high-risk group. In fact, anyone with a body mass index over 50 is considered super obese and has an even higher risk than our average patient would have for developing problems.
My wife and I did a lot of research when I decided to have weight loss surgery. And I chose the sleeve mostly lifestyle reasons.
Really what the operation's based on is changing the stomach into a narrower tube like the esophagus or the small bowel.
The recovery for my surgery, Dr. Marvin tells his patients up to 3 weeks to return to work. So I took the full 3 weeks off. I had the time to take. I probably could return to work after 5-7 days.
In modern society, we just don't need a stomach that we've been provided with. Whether it was evolutionarily necessary to be able to store a lot of material at one time because humans or pre-humans were not eating very often, but with the way our society is now, we simply don't need that much stomach. For some people, that becomes the pitfall. The capacity's there, and it generates the extra hunger that's just not necessary anymore.
You know, it is a complete lifestyle change. The day I came for my very first weigh-in, I weighed 429 pounds. Today I weigh 265.
These operations provide the best chance of curing diabetes there is. People with diabetes generally go and see an endocrinologist who will try to control the blood sugar with medications, but that doesn't make the disease go away. Having a gastric sleeve, or particularly a gastric bypass, the cure rates are high. A gastric bypass, the cure rates for diabetes are probably 80%, 85%, maybe higher than that.
For the sleeve surgery, they say the average patient can expect between 45 and 83% of their excess body weight to disappear, go away forever. I had surgery, day after tomorrow will be 6 months ago, and I've already lost 63.6% of my excess body weight. I sleep much better, I feel much better. You know, I mean, everything's just so much better.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
My symptoms are, I don't want to walk on the ball of my foot. It shoots sharp pains up my leg. I mean, it feels like a nerve's being pinched off.
Wanda's a patient that presented to my office complaining of shooting pain, down her heel, upper leg, and so immediately I started thinking maybe there's a possibility of a nerve, compression.
I told him my symptoms. He suspected what it was. He wheeled in a little mini ultrasound machine, did it right there on the spot, and diagnosed the problem. And we set up surgery because I had already tried other treatments with other doctors and it didn't work, and we were done.
This is your ankle joint, and you have a major nerve that courses through here. There's a natural tunnel. It's called your tarsal tunnel. What happens is the tunnels get real tight and they clamp on the nerve, are the protective covering, which we call the flexor inoculum. The nerve tends to get stuck underneath it. So what happens is when the nerve gets compressed, it's extremely painful.
What he's trying to do is avoid that numbness, and for most people it works. You basically take what's pinching the nerve off away, and you make room for it, and life goes on.
And the advantage of this is, it's not a surgery where you're really held up for a while, where you have to, stay at home and you can't put weight, because I want the patient walking as soon as they can, because I don't want those tunnels to tighten up or to close up. So I want to make sure the nerves can glide. Wanda had tarsal tunnel surgery. She comes back to the office 3 to 5 days later, and just dressing change. No need for x-rays because we're not doing any bone work, which is great too, because if you're not doing bone work, it's not necessarily as painful. There's less swelling. And so 2 weeks later, sutures are out and she's walking on her own.
I'm very happy. I've actually recommended him in all my friends that have gone to him, and they've had more extensive things done to them where, you're reattaching muscles and putting in screws, really crazy stuff. They also think he's awesome.
The side effect that one has from nerve decompression is not pain, it's lack of sensation, it's numbness. And that's temporary because with time they regain their sensation, but it's a really easy recovery and it provides immediate relief.
That'll do it. That'll wrap up another edition of the Best Docs Network. Features some of the best doctors in the Houston area that help change people's lives.
And for more information on any of the doctors you've seen on today's show, be sure to visit our website. It's bestdocsnetwork.com.
And for people who have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We'll see you next week.